We've talked about some extremes of treatment, surgery and non-pharmacological options. What about injections, spinal injections specifically?
So the important decision is not when to do injection. I think the important thing is when not to do the injections and how many injections you should do. Sometimes the medication in these injections are steroids. So we don't want to bombard the person with steroids.
The most common injection is the epidural injection, and there are 3 different ways of coming into the epidural space. There's caudal, transforaminal, and interlaminar.
Yeah, actually, these are for low back because that's the most common problem with we have this spine. I can explain to you. I don't want to show the needle because the people will be afraid. It's not the needle. It's basically the people get pain in these injections when you're entering the skin. That's the only part. So whether it's a small needle or a big needle, the pain is when you're entering the skin. That's the most sensitive boundary of people. And then the other part where they can feel some pain is when you touch the bone. The tissue in between actually are painless to the needle. So nothing to worry about. Once people have so many fears in their mind, then the treatment becomes very difficult. So say if this is the disc coming close to the nerve root and I want to be just here. Okay. I don't want to be here or here. I want to be here. And when I put a contrast, the contrast is going to move upward and downward. And that is, I will make sure that my medication will also go in the direction of the contrast. So this is a transforaminal injection. The foramens are the keyholes out of which the nerves are exiting. Okay? And translaminar is just because these are the lamina, 2 wings of the spine, and between there is a space. The issue is most of the problems are in the front. So going translaminar may not be that effective. So that's why most of the time I do transforaminal injections. Once in a while, if the transforaminal approach is difficult, we can go translaminar because the medication can flow forward. The caudal injection is basically, there is a natural hole in the lowest part of the spine, which is roofed by ligament. So you just go there like half an inch, and in front of that there is nothing. And you put the medication, and the medication will flow all over and take care of the back pain.
Now, what other injections aside from epidural are done?
Well, for cervical, for neck and the mid-back, most of the time the facet joints, they are the source of pain. So if there is a facetogenic pain and we are treating it with epidural, the person will not get better. And person sometimes loses the confidence in injection. Doc, I got the injection, I didn't get better. Well, probably the diagnosis was not correct. So in a way, epidural injection, if done, if thoughts are given before doing the epidural, whether the person is getting pain from epidural area, front part of the spine, or the back part of the spine.
And what about the cervical spine?
Well, the cervical spine is very interesting because that's the part of the spine which is most mobile. And especially when an impact occurs in car accidents or other injuries, the joints in the spine, the facet joints which I mentioned for the lumbar spine also, they get the most effect. And facetogenic injections could be very useful. However, before that, we want to be minimally invasive. And for that, what I found very useful was to do trigger point injections, which are the knots in the muscles. A little bit of numbing medication in those knots after recognizing them, of course, and then that relaxes the muscles there, and as a result, the nerves have time to heal. And so in this way, with minimum invasive, very safe way of doing things, the person's neck pain can be better. However, if that doesn't work, then we can go on to facet joint injections. And if the facet joint injections provide significant relief, we can ablate the nerve that is feeding those joints.